So good morning, everyone. I want to just make sure our audience can hear me. If you can, just jump in the chat for our audience and just give me a good morning, a buongiorno, a bonjour, or whatever it is that you speak to make sure that you can hear me. I appreciate that. And if you feel inclined, let us know where you're listening in from. I appreciate that. So I'm seeing some chats coming in. Very good. So as Aaron mentioned, I'm Dan Onofrio, President and CEO of the Bridgeport Regional Business Council. For some of you that are on the call that may not be aware of our organization, we're really a makeup of 3 chambers of commerce. We operate the Bridgeport Chamber of Commerce, the Trumbull Chamber of Commerce, as well as the Stratford Chamber of Commerce. And then in aggregate, we make up the Regional Business Council. And it's significant. I like to mention that because we're not only helping businesses across the region in their local communities, with whether it's Stratford, Bridgeport, or Trumbull, but we're also very much involved in the economic development discussion from the region through a regional lens in collaboration with our municipalities from the region, as well as some government relations and public policy items. Public policy impacts economic development, and we're very much about that at this organization and trying to create jobs and give opportunities for people along the way. And that is the theme of today's session, right? With the last 18 months to 2 years, it feels like forever. There's been a lot of questions and concerns, not only from the employer perspective, but employee perspective on where we go and how we navigate this COVID pandemic. And now that we're starting to see some light at the end of the tunnel here with the vaccinations, we're hearing from a lot of our partners that are on this call today and others, just how does this impact me as an employer and my employee? And what are the hesitations that maybe some people have around the vaccine? So we'd like to clarify a lot of that stuff and provide a little bit of guidance with our wonderful panelists today from the business perspective on what they can and can't or suggested recommendations do related to bringing their employees back. I know that's a big concern as we navigate the next stage of this pandemic and hopefully the end of it is what I'm hopeful for. So I would also like to invite those. We've got a really serious lineup of questions. But for the panel, for the attendees that are on the call, if you have a question you'd like to ask, throw it in the Q&A section. You're more than welcome to do that. I'll do my best as we go through this next hour to navigate the questions. I'm sure we can probably spend quite a bit of time on this discussion, but we're going to try to keep it to an hour. I know everyone's got a very busy day, and I just appreciate everyone's time to join us this morning. So with that, I'd love to introduce our panelists. We've got a great lineup, and also a quick shout out to both Yale New Haven Health, Bridgeport Hospital, as well as Hartford HealthCare and St. Vincent's Medical Center for co-hosting this event today. It's been a discussion we've been talking about for quite a while, and it's just wonderful to have some resources right at our fingertips here to join us this morning and to get the word out about this important discussion. So thank you both for co-hosting this, and of course the City of Bridgeport is always wonderful partners of ours along the way. But I'd love to introduce our panelists. We've got a great group of folks here that have done wonderful things over the last year and beyond, and we're looking forward to hearing about their expertise as this conversation goes along. So starting off with the intros, I'd love to introduce Dr. Greg Fuller. He's Chairman and Department of Medicine for Yale New Haven Health, Bridgeport Hospital. Dr. Buller received his undergraduate and medical degrees from the University of Kansas, and then completed his internal medicine residency, his chief residency, and his nephrology hypertension fellowship training at Duke University. He then came to the Yale system, where he currently is clinical professor of medicine, chairman of the Department of Medicine at Yale New Haven Health and Bridgeport Hospital, and associate chief medical officer. He has received more than 20 Yale teaching awards and is the author of more than 100 scientific articles. Dr. Buller is a former professional tennis player and an avid skier and racer. So thank you for joining us this morning, Dr. Buller. So we also are welcoming Dr. Jurate Ivanaviciene, who is the infectious disease specialist at Hartford HealthCare. Dr. Ivanaviciene is an infectious disease physician at St. Vincent's Medical Center in Hartford HealthCare's Fairfield region. She is a division chief of infectious diseases, hospital epidemiologist, and responsible for infection prevention, antimicrobial stewardship, and patient care. She is an assistant professor of medicine, infectious diseases at Frank H. Netter, MD, medical school, of medicine at Quinnipiac University and the University of Connecticut. Dr. Ivanaviciene is a frequent guest on Channel 12 News, who I've seen several times discussing the coronavirus outbreak, and is excited to participate in today's panel discussion. So welcome, Dr. I. We also welcome Ebony Jackson-Shaheed, who's the epidemiologist and acting director of health for the city of Bridgeport. And I, again, acknowledge the city of Bridgeport. I think they've done a fantastic job throughout this whole pandemic. But Shaheed is, Ms. Shaheed is an epidemiologist and acting director of health and social services for the city of Bridgeport that has a passion for chronic and infection diseases. Ms. Shaheed has completed her postgraduate fellowship from Yale University School of Medicine in Neurology at the Epilepsy Research Center. She has been doing research at the VA Outcomes Research Center in West Haven, Connecticut since 2016. Ebony has several publications in neurology and psychiatric journals surrounding topics of chronic neurological disease related to comorbidities and the roles of social determinants. She considers herself a public health advocate for communities facing large health disparities and disadvantages. And we also welcome Ebony, of course, and we now welcome Ramon Peralta, who's the founder and brand officer for Peralta Design. Founder and creative director Ramon Peralta holds a Bachelor in Fine Arts and Visual Arts and an honorary doctorate from the University of Bridgeport. An ATUC Executive Business Program alumni, he developed a passion for entrepreneurship and launching brands after serving as senior art director on the original startup team behind Priceline. He went on to spend 10 years working alongside Jay Walker as Walker's digital creative director. And today, Ramon proudly leads the multicultural, multidisciplined, loyal flight team at Peralta Design, personally ensuring that the desired look and feel of every project launch sequence is communicated consistently across the entire brand's digital footprint, whether it is website, video, social campaigns, digital strategy, or printed marketing materials. Ramon enjoys giving back to the community as a life member of Alpha Phi Alpha fraternity by volunteering for junior achievement, speaking to underprivileged youth, and serving as on various nonprofit boards. And outside of work, Ramon is a car enthusiast who enjoys autocross, golfing, traveling, and cycling. Ramon and his college sweetheart, Nancy, have 2 adult children and are currently enjoying life as empty nesters. I look forward to those days. I still got a long way to go, Ramon. And finally, attorney Gary Phelan from Mitchell & Sheahan. He hit Mitchell & Sheahan, if you're not familiar, in Stratford, as well as White Plains. They're expert employment law attorneys. He has been basically the lead on the COVID-19 expert discussion related to COVID-19. And Mr. Phelan is a partner at Mitchell & Sheahan in Stratford, a boutique labor and employment law firm which represents employers and employees. He is the co-author of a book titled Disability Discrimination in the Workplace, and he teaches disability law at the Quinnipiac University School of Law. Recently, he has written several published articles on COVID-19 and the workplace, and he has been selected by peer review and Best Lawyers in America for the past 26 years. So panelists, thank you again for joining us this morning. So with that, we're going to jump right into this thing, if you don't mind. And we're going to try to keep it organized as we go through, just so we can keep the discussion flowing. So I'm going to start kind of high level, and then hopefully we can drill down into some detailed questions to help our employees and our employers that are on the phone today. So starting off with Dr. Buller, I'd love to just be able to get an idea from your perspective, this concept of herd immunity, and what's the importance around herd immunity. We hear that term often, but what does it mean really?
Thanks a lot, Dan, and thanks for that introduction. So herd immunity is where a critical number of individuals are immune to any given infection. Generally, at a bare minimum, that takes 70% of the population, probably a lot closer to 85%, and also depends on just the severity of the actual infection that's moving through the community. So you can view it as if, say, the vast majority of individuals are immune, and there are a few individuals who aren't. If one of those individuals catches, for instance, COVID, they can't really pass it along if they're surrounded by people who are immune to the disease. So the disease kind of, ceases to exist once that person fights the disease off. But again, the key is, what actual number of people that is. It's not really clear, and it certainly depends on just the severity of the illness itself.
Excellent. Thank you very much for clarifying that. I always wondered, how do you, what's the threshold for herd immunity? But I appreciate you clarifying that for us. How about the, there's a lot of questions out there. We hear often from people that, are saying, oh, I don't really want to have the vaccine. But can you just give us an idea of the safety and efficacy of each vaccine? And are they effective against new variants?
Right. So first, the safety, they're all incredibly safe. If you look at the most severe side effects of the RNA virus vaccines, namely the Pfizer or Moderna, they have a rate of anaphylaxis that approaches 1 in a million. Might be a little less than that, might be a little more than that, but it's really, really, really uncommon. We're talking about severe side effects here. It is much, much more common to have a severe side effect from various antibiotics, from bee stings, from driving on I-95 on a regular basis. There's so many more dangerous things. It's, a slightly higher chance of getting hit by lightning, for instance. So these are very, very safe. Certainly, though, everybody who's had a vaccine out there, and I suspect that the vast majority, just knowing how many people in the state of Connecticut have been vaccinated, you will, of course, experience some effects. And notice I'm not saying side effects. These are expected effects of the vaccination itself. Your arm got sore. You might or might not have had a little bit of fever, some chills, some muscle aches, et cetera. But of course, those all passed. And these are common findings with both the Pfizer or Moderna vaccine and certainly the Johnson & Johnson vaccine. So the Johnson & Johnson vaccine, as everybody knows, there was a pause on it for a bit because a relatively novel side effect was identified that is very, very, very uncommon, and to my knowledge has not yet been described in the state of Connecticut, for instance. And this is a complicated kind of a overactive clotting occurrence that seems to be a bit more common in younger women than others, but is not exclusive to younger women. And it mimics, it's due to the creation of a certain type of antibody within your blood that mimics something that can happen with a medicine called heparin. Again, if there was not the surveillance going on, looking at every possible potential side effect of these vaccines, if this were a normal drug release, for instance, almost certainly this would have never been identified as a side effect to this vaccine. It's just how uncommon it really is. So all of these vaccines are incredibly safe, certainly compared to just things that you wouldn't even think twice about taking, like various antibiotics, for instance. So with respect to the variants, the mRNA vaccines, namely the Moderna and the Pfizer vaccine, of those two, the best studied is Pfizer. And the Pfizer vaccine appears to be extremely effective against the variants to which it's been studied. And the two main variants in the state of Connecticut are what we call the wild type form, which is the original kind of COVID. And then there's the so-called UK form, which is more highly transmissible and, is certainly taken a hold in the entire United States, but certainly also in Connecticut. Pfizer vaccine is virtually equally effective. You may not get quite as much of an antibody response, but for all intents and purposes, it's every bit as effective against those types of infections. Now, the so-called South African variant, other variants identified within the United States, and then the Brazilian variant, which is fortunately very uncommon within the United States and probably doesn't compete very well with the other viruses. It appears that also the Pfizer, and I think you can extrapolate that to the Moderna vaccine, are extremely effective, just as effective against against the so-called wild type, the original form of COVID. The Johnson & Johnson vaccine, where it matters most, namely reducing hospitalizations and certainly death, appears to be very effective. Is it as effective as a Moderna and Pfizer vaccine? I think that remains to be seen with respect to the variants, because of the lack of studies compared to the number of Pfizer studies, Pfizer vaccine studies that take place.
Excellent. And why the 2 doses for Pfizer and Moderna?
Yeah. Well, so if you look at the immune response with 1 dose, and then how effective is it? It's still, let's say somewhere in the 80%, 85% range at effectively preventing symptomatic COVID. But that goes up to 95%, 94, 95%, even in real world studies. So there is a significant improvement in the antibody response if you take the 2 doses. Doesn't mean that a single dose doesn't have some degree of effectiveness, but particularly when we're talking about antibody response to protect against variants, I think it's extremely important. Hard to overemphasize how important it is to get both doses. And just anticipating, well, what if I have I wait too long to get a dose, for instance? No problem, you just get the dose. There's no situation where you need a 3rd dose, for instance, of either of those 2 vaccines. If it's delayed, you still just get the dose.
Understood. Now, do you anticipate a booster shot being required because of the variants, or as time goes on here? Is that what you're hearing, or no?
Oh, I think almost certainly there's going to be some type of a booster. Particularly if there's an increasing number of variants, which I'm not so sure if that'll happen so much within the United States, but again, once we open up our borders and people start coming in from various other countries, bringing in potentially various mutated strains, then I think that the pharmaceutical companies can pivot very quickly to make a booster that is maybe modified a bit to provide better protection against those other variants. So I think we can look forward to having another vaccine in the fall or winter, somewhere in there, most likely. Again, nothing's set in stone, but that would be my prediction.
Right. And one of the things that you hear a lot of people questioning is, they have the shot, they don't have a reaction to either of the vaccinations. They're like, well, gosh, did it really do anything? So from your perspective, can you clarify that myth or that particular conversation around, gosh, if I didn't have a reaction, does it mean that it didn't work, or it is working?
All it means is that you were really fortunate. That's about it. The study's done looking at the effects, the various effects you can experience, and the antibody response doesn't appear to be a direct correlation with either one. So yeah, you're just one of the fortunate people who just didn't have a lot of effects, outward effects of the vaccine. Right.
And with folks who have tested positive with COVID, from what I understand, there's a period of time where they should be. It's recommended that they're waiting to get their vaccination. Is that still on the table right now?
Right. So if you've had COVID, you want to wait at least a couple of weeks after you are asymptomatic before even thinking about getting the vaccine. Now, what's the most appropriate timing? It's still not really all that well known. And the CDC recommends waiting at least a couple of weeks beyond when you became asymptomatic and up to 90 days. Because we know that if you have an infection, you have really significant immunity for at least 90 days. Now, the exception to this is in patients who have received one of the monoclonal antibodies, which are given to people with mild to moderate COVID who are outpatients. You've received a monoclonal antibody, then you have to wait at least 90 days after you've received that antibody before you get the vaccination. And it's really, really important for individuals who have had COVID to get vaccinated. And the reason is that the vaccination actually stimulates more of your immune system than just getting the infection. And it also helps protect you, as we've already pointed out, against the variants, whereby you may not have nearly as much protection from just, getting the infection from a COVID variety that is not one of the variants.
Great. Thank you for clarifying that, Dr. Buller. I appreciate that. So just moving the conversation along, and feel free, Dr. Buller, as we move to Dr. Ivanaviciene, if there's something you'd like to add along the way with the questions, feel free to respond as well. But welcome, Dr. I appreciate you joining us this morning. And building on that theme, now, especially with the upcoming week, it sounds like, mask mandates are going to be lifted. I suspect that, people in contact with others, perhaps that do test positive, can you give us some, just from your perspective, the current level of exposure that would recommend quarantining? I have 3 young children, and they're playing sports and in school, and it's always I always question, okay, they've been exposed to someone who has COVID or tested positive for COVID. So how far down the chain do we have to be mindful of staying home and quarantining?
So there are 2 situations. There are situations for quarantining for vaccinated and situations for the people who are not vaccinated. So for those who are vaccinated, the quarantine it's not longer recommended, right? So if you had your vaccines and you completed 2 series of your vaccines, you don't need to quarantine. Now, in the situations where you have a household people who are not vaccinated and they've been exposed to somebody who tested positive, so the exposure that requires the quarantine is if you were exposed to that person for longer than 15 minutes in a close contact, meaning in less than 6 feet apart from you, and you were not wearing the mask. You should actually, your child or your spouse who were exposed should get tested. Now, you can lessen your quarantine if you get tested, and if you test at least day 5 or longer time from that exposure. If you're negative, you can actually return to work at day 7, but you should still continue. You should continue to monitor for the symptoms, for fevers, for nasal congestion, and all of the other, for headaches, all of those symptoms that people come after they've been exposed to COVID. Now, in different situations, I think it's more complicated if you have a family member who tested positive in the house, right? Then it's becoming a little trickier. And, even in the hospital settings, if we have somebody who tested positive from the household, the first question, can you isolate yourself from that person and then don't get in the contact? If you cannot isolate yourself from that person and you cannot get, away and kind of so you're isolating in the separate room, using the separate bathroom and kind of keeping the distance, people are required to quarantine and get tested and monitor their symptoms. And usually what we ask that they should stay in the house for at least 14 days in certain situations. And if the household is a lot of family members, it's really high because your incubation period varies. So every single patient can get infected at a different timing. So sometimes we extend that quarantine based on case by case cases.
Excellent. Would you mind repeating? I know you mentioned in there, employees returning to work and their isolation with someone testing positive in the house. So I just want to make sure it's clear for the employers and employees on the call. What is that time period once they are exposed to someone that has tested positive to COVID, on whether they, if it's a spouse or a child or whatever, and how long they should stay at home before returning to work. I just want to make sure it's very clear for our employees and employers on the call. If you don't mind, Dr. I appreciate it.
So as we all know, the incubation period is 4 to 14 days. So when you get exposed initially, right, you don't develop any symptoms, although you might have some low numbers of virus in your body. So if the spouse or the child got exposed to somebody, right, first of all, you need to get them tested, and you have to stay at home while you're waiting for those results. You can't, even if you feel fine, you should not go to work until you get your results. Now, the important part that, when they test you, and it depends on where you go for your testing. I think different pediatric offices or different physician offices, they recommend a little different testing, but you should get tested. You should quarantine and get tested yourself I would say day 5 after your exposure and going forward. And while you're waiting for your result, if your result is negative and you're asymptomatic, you can return to work. And most of the time it comes into day 7. By the time you get the results, most of the places require PCR test and not antigen testing. So on the day 7, if you test negative going from day 5, you can return to work. You should still continue to monitor your symptoms, even if you tested negative.
Got it.
So maybe I can break in and ask for Dr. I's opinion. I'm assuming this means in unvaccinated individuals. I mean, the CDC has changed all this recently for vaccinated people. If you're asymptomatic and you're exposed to someone who has known COVID and you remain asymptomatic, you don't have to quarantine, right?
Correct.
Except now the healthcare setting's totally different. I don't know, Dr. I, do you want to comment on that at all?
So definitely. So the new, like as I mentioned in the beginning, if you're vaccinated, you get exposed, you don't need any quarantining. You just have to observe yourself. And I can go and talk about the vaccine breakthrough cases, which occurs really in low risk, low rates. So we don't need to quarantine ourselves if we are fully vaccinated. In the healthcare settings, it's a little different. We have our protocols where if somebody gets tested from the family, if somebody gets tested positive, we ask to, isolate themselves. If they cannot isolate themselves, they should stay out of work and quarantine themselves. And like I said, we go based on different situations are different. Family members, if you are just you and the spouse, is different. If you have another 4 kids, I think then your quarantine period may be extended a little longer. At least that's what we do in our hospital.
Understood. Thank you for clarifying that. Now, if someone's tested positive, there's always the question, and you alluded a little bit to it in terms of the, how long you should quarantine and all that. But how long are you actually contagious before and after the symptoms? Like, what's the timeline look like once you identify, I'm having symptoms?
So most of the people who've been exposed to a COVID positive person, they develop symptoms between day 4 to 14. We consider them infectious a couple days prior to them developing the symptoms. We know as the virus replicates in their body and the amount of the virus increases, and then they start to develop the symptoms, they are contagious a couple days prior to their symptom onset. People usually stay contagious. We tell them to quarantine. There is a reason why we tell them to quarantine up to 10 to 20 days, depending on the disease severity. If the people who were hospitalized and had more severe disease and they were on ventilator, we assume that they had a viral load, which was viral numbers way much higher. So we are telling them to quarantine up to 20 days.
Got it. Thank you very much. Okay, now I'm learning some new terms as I go through this. So can you describe what is a long hauler and what other long-term symptoms do they experience?
So these are the people who are continue to have symptoms past 28 days. So after weeks and weeks since you've been positive, you can continue to have some of the symptoms. Most of the symptoms that I've seen and complaining people of having after they had COVID, especially the ones who had severe disease, they complain of that exhaustion and fatigue, that they were not able to do any daily activities. They also complain of the fog, kind of having hard issues in concentrating, having issues, with performing their usual tasks that they used to perform. Some of the people complaining of some memory gaps. Some of the people still persistently have loss in their sense and smell sensation. Some people complain of dizziness while they are standing. We call it orthostasis. Some people continue to have shortness of breath and they still need an oxygen supplementation. Muscle aches are another symptom, joint pains, and some people can have chest pain. So those are the people who have kind of prolonged presentation of COVID. And I hear also people who initially were asymptomatic and had no symptoms initially can actually continue. Their symptoms can start later and they continue to have those symptoms for weeks.
And about how long do the recovery period? How does the recovery period take once you get through that?
We're learning a lot about them, so it could last weeks and months, and everybody's different. So it's really, really hard to say the period of time for how long you will have these symptoms and how long, you will need the specific symptomatic treatment or oxygen supplementation.
Okay, good. All right, so now this week, a lot's changing as it relates to the mask mandates, right? And for a lot of our employers on the call, this is a question that we're hearing, and I'd love to get your perspective on it. But if everyone in the office is vaccinated, could they all go into the office without wearing their masks at this point?
Yeah, so as per CDC recommendation, we had this discussion a couple of weeks even ago. You can go into your office and you don't have to wear the mask if everybody in the office is vaccinated. The tricky part is if you don't know if everybody's vaccinated, right? That's the tricky part. But if you know that everybody's vaccinated, you definitely don't have to wear the mask.
Got it. And so is it possible that someone that may be asymptomatic in the office, is not wearing a mask going to increase the possibility of the spread?
So it's always a possibility, right? But the chances for you of, getting this, I would say, spreading if you were vaccinated, it's really low, because the vaccine breakthrough cases, the numbers are very low. So there is always a possibility, but like I said, it's very, very low. It's 0.1 from our Connecticut data that we received on May 7 after looking into all of the vaccine breakthrough cases.
That's positive. That's good news. Good. And how about the hospitals? Are they making the vaccines mandatory for their staff and at this point?
So we are not making the vaccine mandatory now. We do have a flu vaccine that it's mandatory. There is a possibility that it could be mandatory at some point, but for now, we're not making those recommendations. Great.
Well, thank you, Dr. Ivanaviciene. I appreciate that, Dr. Bowler again. So moving along, I want to drill into the good work the city of Bridgeport has done here, and moving along to Miss Ebony Sheahan, who again is the epidemiologist and acting director of health for the city of Bridgeport. Thank you for all your efforts, Ebony. We it's really been an interesting time, especially for our larger municipalities. But how is the city of Bridgeport supporting the distribution of the vaccines at this point to the general population and addressing the vaccine hesitancy around that?
I just wanted to say thanks, Dan, so much for that introduction. That was great. And I honestly must not take all the credit. I have an incredible team here. We all work well together. So when you're talking about efforts, you're talking about all of our efforts, employees and everything. They've been staying here sometimes till 9 at night, making sure that everyone is safe in the city. So I definitely want to give them their props for what they've been doing. In terms of the distribution of the vaccine, the city of Bridgeport does not distribute vaccines to any providers within the city. We get all of our vaccines from the state of Connecticut. So everyone, all the vaccine providers throughout the city individually request vaccines for whatever clinics that they do at that particular time. So the city of Bridgeport does not distribute any vaccines to providers. So I just want to, just clarify that. But there are quite a few vaccine providers within the city of Bridgeport. We have Yale New Haven Health, who's here. They've been here from the beginning, helping out with mass vaccination. We have Hartford HealthCare, we have Southwest Optimist. We have clinics all over the city, and we're just really trying to ramp it up on the vaccine efforts. We've been doing that since the vaccines have been distributed. Right now, we're seeing a little bit of a trail off, and we really don't call it vaccine hesitancy as much. I think it's more a lack of education. And so we've been doing a lot of that through our campaign efforts. The city of Bridgeport has an amazing communications department. So we really have just been, I don't know if you've driven around the city of Bridgeport, we have signs literally everywhere. A lot of individuals that come into the clinics to get vaccinated, they say that they learn about the vaccine through a lot of our signs. So we definitely put a lot of information on that just for the general public so that they can understand what the vaccine is, who's eligible for the vaccine. And basically they learn the information from our signs. We are also on BETV, and we also have been on various Latino and Hispanic radio shows or radio stations, and we do some promotion that way as well.
Yeah, I've seen the Vax facts, I think is the term I've been seeing around town on the materials, just to try to, as you pointed out, just to educate people on some of the myths and clarify the significance of the vaccine. And I just kind of like that term, the Vax facts. Excellent. So you just touched upon it a little bit there. If you can expand, it'd be great. But how is the city ensuring that vaccines are being equitably distributed? I know you mentioned putting some of the materials in other languages and stuff like that, but it'd be good if you can expand upon that, because I think that's an important point to make here in the city.
Well, right now we actually just got the equity grant, and I know a lot of municipalities have received that as well. And that's basically to address some of the vaccine gaps that we've seen in the city. So people who may not have access to transportation, people that still may be a little hesitant, some of the communities that just really, some of those zip codes that are still lacking in the vaccination numbers. We basically are going to be canvassing through the city of Bridgeport, going door to door, and having mobile clinics set up in these specific zip codes that we're targeting, and having people really just come on out where the clinic is, and the clinics are in their community, and then get them vaccinated. We also are working in partnership with DPH. I don't know if you've seen the yellow vans around, but they are working with us as well to make sure that these equity gaps are being filled. They're going out into some of the low-income housing areas. They're going to start going into some of the big box stores to try to get employees vaccinated. These are individuals who, are lacking in access, and we're definitely trying to close those gaps. In terms of people who, the immigrant population, those who do not speak English, we've been in restaurants where they have big community rooms in the back, especially for the Hispanic population. I don't know if you guys know any of the numbers, but the Hispanic population within the city of Bridgeport has surpassed their other racial counterparts in terms of getting vaccinated. So we really have been, really out there. We have a lot of individuals in our clinics that speak Portuguese, that speak Spanish, English, some speak Arabic. We really are trying to appeal to our residents and making sure that, they're able to feel comfortable when they're, coming out and getting vaccinated. Even for those who have no documentation, they come in. We take walk-ins as well. So when they come in, even if they have a passport that's in another language, that's all they need. If they don't have any identification, they sign an attestation saying they are who they are, and then they go ahead and they get vaccinated. So we make, we make it them able to come and get vaccinated and just come as you are.
Excellent. Yeah, I just want to highlight the point that you made on, leveraging the data and leveraging zip codes and trying to really target specific communities and neighborhoods. I think that's an important point, and something that, it's always great to hear, because, sometimes people are concerned, like, oh, you're just kind of putting information out there, but not really helping those most in need. But the city is doing a great job, I think, from what I've heard, and just you validating it here today, how they're being smart about where they're targeting their efforts and getting to those populations that just, for whatever reason, haven't taken advantage of the vaccines and the information surrounding it. So thank you for highlighting that. How about now, we're talking about things opening up a bit more, and, we have the amphitheater opening up, and, I think they've already had some graduations this past weekend, and we're all anticipating the concerts. But for these larger venues, and even restaurants for that matter, are there any specific guidelines that the city is putting out there to help related to the gatherings at these locations?
Yeah, so there are a couple of new guidelines. I mean, honestly, there's a guideline that was put into effect May 1st, and that basically was a curfew for restaurants, entertainment venues, recreation venues, theaters. They basically moved back 1 hour to 12 a.m. So bars that do not serve food can open for service outdoor only. Food is still required when serving alcohol indoors, and the 8-person per table limit was lifted outdoors only. And then the limit remains for the indoor dining. And as far as May 19th, which is coming up in a few days, and I know everyone is waiting for that magical day, right? Basically what's on the CDC, or not the CDC, but the Connecticut Department of Public Health website as of right now, is all remaining business restrictions will end as of May 19th, and indoor masks will continue. The Connecticut Department of Health will issue recommendations for indoor and large outdoor events, examples, concerts. So I do understand how a lot of people have been coming to us about, can we take off our masks now? Can we do this? We're hearing, all this good information. We're so excited. And I definitely love to say that, but as the health department, we definitely have to make sure everything is documented. So whatever we see from our governor and what he advises us to do, that's what we're going to move forward on. And as of right now, we go with what's documented. And when May 19th comes out, we'll see what, is what's being said, and we will definitely deliver.
Great. And, shifting the conversation a little bit now towards, specific questions that we received from employers and employees. And I open this question up to all our panelists, but how do you recommend, Ebony, employers help employees get vaccinated at this point?
We've had some talks with the Connecticut Department of Public Health, and, on some of these panels that we have discussed this topic, it's been, talked about that hopefully a lot of employers will host some clinics themselves. And we've had some individuals in the community, some residents that are saying that, we're not able to get to the clinics because, we work like these crazy shifts and we're not able to get off to come to the clinics. Although I think some of our clinics, we have, varying hours, but, we can't be open 24 hours a day, right? We're going to try to do some, some marathons, but I really think that, we really think that if some of the employers host clinics themselves, they can reach out to the Department of Public Health. They can reach out to some of the other vaccine providers, Hartford HealthCare, Yale New Haven Health, get them in there, do a partnership with them at their location. It could be a factory, it could be a grocery store, and get them in there, host a clinic, and then have your individuals, your employees be able to get vaccinated during their shifts. So that's definitely something that I think employers should look into and definitely make that investment for their employees.
Excellent. I'm just curious, since we have a business owner, Ramon, on the phone, have you done anything specific, Ramon, in terms of getting your staff vaccinated? I'm just curious if that tied in at all to what Ebony just said.
Yeah, no, we're first of all, I'm here to learn, and I've gotten a lot of great information as well. But we're filing it under our TCOB policy, take care of business, which means just do what you need to do to get vaccinated. We're strongly encouraging it. We're not mandating it, but we're strongly encouraging it. And so we're also budgeting a second day for recovery from that second shot. So we're not booking meetings with that particular employee or staff member. So just being extra flexible. It's just falling under, do what you need to do to be safe and to get back to work and to feel better. So yeah, so that's kind of what we're doing. It's just being extra flexible.
Excellent. And we'll come back around to more on the employees returning back to the office. But before we head into that, this is a question for both the physicians as well as Attorney Phelan. A lot of offices basically have turned visitors away during this period, and now they're starting to let things, open up again, whether it's, some suppliers, contractors, visitors to the offices. So right now, what are the guidelines for non-employees entering the office space?
Well, I know.
Yeah.
I mean, I'm not sure there are good guidelines. That's why I think both Dr. Ian are kind of on mute. I mean, in the hospitals, of course, we're letting visitors come in, right? So, but it's limited, and it's only in a certain way. So again, you just have to. It's all about risks and benefits. The risk is, and I think again, it was pointed out earlier, you have no idea who's vaccinated and who isn't. So, I mean, you can ask people that if they have any kind of even mild illness that they shouldn't come in and visit, but if on the other hand, the vast majority of your employees are vaccinated, if you know, or virtually all of them, then that presents really no risk of any significance to your employees. So, you know, again, it's hard to generalize here. I think it has to be, you know, approached on more of an individual business by individual business basis. I don't know, Dr. I, what do you think?
Yeah, I would agree. It's really hard because there is really no recommendations. We do temperature check for everybody who enters the hospital. We actually do check for our employees. We have an app where they check the temperature and a symptom check. And if they fail, they're not allowed to come to work. Whoever doesn't have that app, we do temperature check every day before entering the entrance. And of course, all the visitors, like Dr. Buller mentioned, they require the temperature check and symptom check.
Attorney Phelan, you want to add your comments there? That'd be great. You just need to unmute yourself.
There's no guidance that's been issued yet. I think it's important to keep in mind, though, that the CDC is an advisory, provides advisory guidance. The agencies that really control the workplace are OSHA, as well as Equal Employment Opportunity Commission. So, on a lot of these questions, we still have to wait and see. And I don't, at least in the short term, nothing that the CDC announced really changes anything with respect to the workplaces in Connecticut. We're now waiting for guidance from, OSHA and EEOC, which is somewhat believed to be imminent. But I think one of the things to keep in mind, OSHA's most recent guidance that they've issued is workplaces should not distinguish between workers who are vaccinated and not vaccinated. So that's the guidance we have with respect to the workplace.
Understood. How about with the restrictions? And I know May 19th, as Ebony pointed out, kind of like the, I don't know what you want to call it, everyone's anticipating 19th and hey, no masks, if you're vaccinated. But from a business perspective, returning to in-person meetings and events and traveling in large groups, just from your perspective, Attorney Phelan and others on the line, is there a recommendation or a timeline or anything associated with, how we should we ease into it, or is it like literally like that's it, let's open the gates?
My advice would be patience and caution. And again, I as I mentioned, as far as workplace guidelines, I think we really have to wait for more guidance from the EEOC as well as OSHA.
Great, thank you. I appreciate that. So Ramon, let's jump back over to you if you don't mind. I know you've done a lot. You both on video on the onset of this thing, keeping your staff and your clients and just educating people throughout this whole year or so, and it's really been great information and inspiring in a lot of ways too. So we appreciate you being so forward and open and honest with how you're operating your business and handling things with your clients. But is there anything specific you want to highlight in terms of some of the safeguards that you maybe put in place in your office space?
Yeah, well, thank you. Well, a year ago, we were putting in plexiglass and hand sanitizer, and we were following Lamont's guidelines with Reopen Connecticut. So we were at 50%. We have essential clients, essential businesses as clients, so we were deemed essential. So we relatively stayed open the entire time. But now we just started allowing clients to come back in and visit us. And we're finding clients are really eager to come in and have face-to-face meetings. And so what we're doing in those situations is, of course, keeping our team safe is the number one priority. So it's really, I'm very transparent to make sure that their comfort level is there with allowing people to come in. And they are. And so what we've done is the folks that have come in, they come in with masks. So the building that we're in one of the Cinto buildings, that the building itself still requires masks on entry. So a client comes in with a mask on, they come into the front, we still have a temperature scanner there. I kind of sequester them into my office to have the one-on-one, so the door is closed. But in the common areas, our team is still wearing masks, especially the folks that aren't vaccinated. To encourage vaccinations, I've said, hey guys, we can have staff meetings, and if you're vaccinated, you don't need to wear a mask. But so we have a mix. We're probably at 70% vaccinated right now. But the client comes in, I have a mask on, they have a mask on. They do the temperature scan, they come in my office. And then when they're in my office, it's kind of like a reprieve, because then I ask them, are you vaccinated? And then we're going on honor system in my own comfort level. My door is closed. Then we take our masks off. And they, assuming that they've said, yes, I'm vaccinated. We haven't had anyone come into the office that isn't vaccinated since we've opened it back up to clients. So a lot of it is for personal comfort level. A lot of it is transparency. A lot of it is making sure my team's aware, and that we're making a very concerted effort to keep them safe. So a lot of it is optics. If no one was there, I'd probably be comfortable with having somebody come in without a mask. But I have to be aware as the owner, as the leader, that I am exaggerating my efforts, if you will, to maintain the right optics so that everyone feels safe at work.
Excellent. And just out of curiosity, so it sounds like you're doing a lot, you're being vigilant still, right, with
Yes.
the process, which is great. But how about the employees? I know your staff, is capable of working remotely and all that stuff. Is there a sense as to, I'm good staying at home right now, Ramon, and
Yep.
or is it,
Yeah.
people want to get back?
The younger, a small team, have 10 of us. Three of us are working remotely. 7 of us are in the office. There's one senior member that is kind of more comfortable working remotely, and we're kind of respecting that. Again, it's going to everyone's comfort level. But I am bucking the trend, and I will kind of plug Cinto real quick here, in that I negotiated to move into some bigger office space. So if you're ever thinking of expanding, I would say you can get a really good deal right now. So I'm expanding, but it's in an effort to bring everyone back, and then provide more space in between each workstation. So because of that, I've been very flexible with everyone's comfort level. So we have a mix right now of 3 offsite, 7 on-site. And the goal is to expand the space so that we can have more room in between each, even after this is quote unquote over. I just want our company to be more forward thinking in what the office of the future looks like.
Great. Thanks for sharing that, Ramon. I appreciate that. And you alluded to, the temperature checks and all that. I'd like to move to Attorney Phelan at this point. Claire, correct me if I'm wrong, Attorney Phelan, but right now, offices or places of employment that are having visitors come in, or even their employees, it's not like it's a mandate that you need to do a temperature check. Is that correct? That's just kind of based on the business and how they feel, is appropriate in terms of how they address this stuff, but it's not a mandated thing.
That's correct.
That's correct. Okay, good. And can I ask about, the tracking of the vaccinations and the status of employees? I mean, are employers, are they capable of doing that?
Well, the employers can ask about vaccination status. And they can also, if somebody says they haven't got the vaccine, they can certainly ask a follow-up question of, do you intend to become vaccinated? Where I think employers may get in trouble is if they ask, why aren't you getting vaccinated? Because then that may be that could be a disability-related inquiry, which the EEOC has said is something that would violate the Americans with Disabilities Act. As far as just maintaining, tracking and maintaining records of who is and who isn't vaccinated, it's unclear yet. From the EEOC has not issued guidance on whether or not that would be considered a confidential, medical information that, for example, should be kept in a medical file. I think to err on the side of caution and do that's a good suggestion.
So at the end of the day, the burning question is can I mandate vaccines in my workplace? And right now the answer is what?
The answer is yes, with exceptions. The exceptions being that if a person had, and I think about most surveys are, anywhere from like 4 or 5% of employers have done this. I think there's going to be more, particularly in certain industries, not just healthcare, nursing homes, but more, education institutions, I think, are going to start to implement them. The first is the biggest, I think, exception is if a person with a disability who for whatever reason is not able to get the vaccine. It's, then you focus on, is the person, can you accommodate the person? And that could be anywhere from wearing masks to working from home or other accommodations. With some jobs, you're not going to be able to accommodate them, and then they're not, basically not going to be able to work there. The second exception is for people with sincerely held religious beliefs, who therefore will not get the vaccine. Again, the question is there an accommodation, and would it lead to an undue hardship? The third caveat is for unionized workplaces. This is going to be generally, the belief is it's something that's subject to collective bargaining. So it is something that has to be discussed. Another caveat is to not be selective and say, like, to certain employees, that you have to get the vaccine, but not have it across the board. For example, if an employer says, older employees, because you're more at risk, you should get the vaccine, that would be age discrimination. So, I think it's going to become a bigger question as we progress, and as people, more and more employers are calling employees back to work.
So in this building on the theme of, some people obviously going through and getting vaccinated and others for whatever the reasons are not. So does that put a burden on the employer to draft different operating guidelines in the office for employees who have been versus those who haven't been?
Absolutely. And not that it's a necessity, but it's a extremely good idea to do so, and to educate, particularly if the employer is, in the process of trying to incentivize employees to get the vaccine, even if it's not mandatory. They do have to, or they should, I think, have written guidelines and to discuss them. The more communication there is surrounding this, the better. At the same time, for example, you have to be careful that this could be considered confidential information. For example, if an employee is being accommodated due to a medical condition or a sincerely held religious belief, that's not something that can be openly discussed. That has to remain confidential.
And I suspect, the other concern from through the employer's lens is, what are some of the legal implications around concerning the vaccine and PTO and how it impacts workers' comp and all those things. So are there questions there or thoughts that you could suggest to help employers kind of navigate those questions?
If vaccines are mandatory, then and somebody is for whatever reason injured in a due to getting the vaccine, that's something that would likely be covered under as far as workers' compensation. It's not required, but I think it's a good idea, as Ramon said, where they give time off to recover from the vaccine. Something that President Biden has recommended, also to give employees time off in order to get the vaccine, or even with some, employers are bringing, where they're administering the vaccines internally. So I think generally those are the legal issues. Also, just to make sure, complying with if vaccines are mandatory, the requirements as far as persons with disabilities or sincerely held religious beliefs.
Great. And then my last question, I know we're coming up on the hour, and I apologize. Hopefully what we can do with the questions, since we're running out of time here for the questions that have come in, we'll capture the question and we'll respond back to you and solicit some comments, some feedback from our panelists here as well. But my last question for you, we're coming to the end of session now here in Connecticut. I think we're just under a month away from the session hopefully closing. We shall see. And I know Florida has enacted some liability protections. Are you seeing or hearing anything on Connecticut businesses, and are there any policies or bills being talked about to protect businesses from potential liability like Florida has done?
The only one I've heard of, it's called House Bill number 5125 that was introduced in January, that would have, similar to the Florida bill, where you'd have to show that the company engaged in some sort of gross negligence in order to be liable for any decisions related to COVID-19. I don't think in this state that that's likely going to pass. There's been a lot of, also including with respect to mandatory vaccines in more the red states. There's been a lot of legislation introduced. They're not necessarily, it's only a few states where those have passed. I don't think it's likely in Connecticut.
Understood. Yeah, I've heard the same thing. So with that, we're just over the hour here. Are there any final comments from our panelists before I thank you all, give you a big virtual hug and wish you a wonderful day? Anything that we may have missed that you think is important to just bring up real quick? And again, for the questions that have come in, I appreciate the panelists answering them along the way. And the ones that we didn't get to, we'll try to track down and consolidate a follow-up to our attendees. But is there anything you'd like to add in closing? Dr. Buller, Dr. I, Ebony, anyone?
So I was trying to kind of answer most of the questions, the ones that I kind of caught my eye. I think the one that it's kind of really, I think a lot of people are concerned about their immunocompromised employees. And what I usually say to my patients, especially the ones who are receiving chemotherapy, I do recommend for all of them to get vaccines. And I know that their immune response will be slightly different than the normal population. So they will have some protectivity, but not like the full protection that I expect. I still recommend for those immunocompromised people who are on chemotherapy and very fragile to wear the mask even after they receive vaccinations.
Excellent, thank you. Ebony?
I just want to say, I think to everyone listening and to any friends and family that are at home, I think that there's so much misinformation out there about vaccines. And we definitely encourage people to not take everything for face value. So I know a lot of younger people we're seeing between the ages of 18 to 39, they get the majority of their information from social media. Not every social media post is fact. And I think that you definitely should turn to someone who's qualified to get the information that you need if you are questioning anything. And that's definitely something that I would say is a closing remark from myself.
Great point. Don't forget the vax fact, right?
Massive, yes.
I just note in younger people that certainly I'm sure hospitals across the country are seeing a change towards younger individuals who are, being hospitalized. We should really look closely at Brazil. In Brazil, there is a significant increase in severe illness and death in adolescents and children. We aren't seeing this yet in the United States or even easily identified in other countries. Whether this is due to a variant, whether it's something else is not at all clear, but we should be looking that way, again, emphasizing to younger individuals to take advantage of vaccination, that it's not necessarily a completely benign problem for younger individuals.
Excellent. Dr. Attorney Phelan, I almost called you doctor again, see?
That's fine, you can call me doctor. I think for employers, it's important I think the two most important words as far as implementing policies are empathy and flexibility. Really, what I'm finding with respect to workers is employers that are flexible are the ones who are going to get through this process. And for example, one of the questions that was in the chat is, can I call back employees? And the answer is yes. You can do that, but at the same time, you may be required to accommodate persons with disabilities. Separate from that, just from the standpoint of keeping good employees working, you might not be legally required to allow, for just fears of returning to workplace, but those are the kinds of things to take into consideration. And so again, to try to be as flexible as possible with your employees and keep the lines of communication open.
Yeah, that brings up a really good question, Attorney Phelan. And just super quick, because I know a couple of our businesses in our network have done this, but can businesses offer incentives? I know one business in our network, a very large manufacturer, you're giving coffee, gift cards to a coffee shop. Just something to encourage people to say, hey, if you come in and you do get vaccinated, here's a gift card to whatever, Starbucks or Dunkin' Donuts.
Incentives, the guidance so far from EEOC is that you can offer incentives as long as they are de minimis. Unfortunately, they didn't define what they meant by that. And so, I've seen everything from, time off, for example, to get the vaccine or to recover from the vaccine. Kroger's, for example, $100, another, $50 gift certificates. That's one of the things that we're expecting from the EEOC is further guidance on that issue. They held a hearing on April 28th, really to address a wide variety of COVID-related matters. And ideally, we'll soon be getting, further guidance on that. But I do think it's something that employers should seriously consider and implement, as long as it's relatively, small. And I think to quantify it, $100 or less, I think is safe.
Got it. How about you, Mr. Peralta? Any final comments?
Yeah, it's making me laugh because earlier on, I've always offered free lunch on Wednesday. And so, or companies, reimbursed or purchased. And so during this time when we're trying to lure people to come back to the office, there is a cafe in our building that's been adversely affected since the building's at a low, occupancy. So in order to help the cafe, I started offering that we'd offer free lunch on Fridays. But now that everyone's coming back, it's getting expensive. But we're gonna keep doing it. But food motivated, incentives being more flexible. The main thing is take care of your employees. They'll take care of your clients, and I think everyone's ready to get back to business.
Excellent. I hear that for sure. So Dr. Buller, Dr. Ivanaviciene, Ms. Sheahan, Ramon, Attorney Phelan, thank you so much for your time this morning. I know you all have very busy schedules. I think it was a very fruitful conversation. And again, for those still listening, any questions we didn't address through the Q&A or on the chat, we'll try to consolidate those and get a follow-up out to all of our participants. Thank you so much for participating this morning. It's always a pleasure to see our partners on the call and all of our friends remotely here. So God bless you all. Have a great day, a great week. Enjoy the nice summer weather that's starting to creep in here a little bit. And we'll talk to you soon. If there's any questions related to your business, please feel free to reach out to the BRBC. I think you all know how to get a hold of us, but we're here and we're ready to help you all.